Hi, welcome to Healthy Coaching, Nutrition Made Simple. It's Dr. Sherry here. So this is a topic that's near and dear to my heart, stress. So I want to talk to you today about why you feel stress and what to do about it. One of the reasons it's near and dear to my heart is because it's something that I personally struggle with the most. And everybody's going to have their one area or maybe a few areas where they find it more difficult to implement changes that they know they need to make. For some it's going to be diet, for some it's exercise. For me it's stress management. I am a go-getter and I've got a busy life and a busy family, and it's difficult for me to find that space in my day to relax and restore and come back to what I call baseline. And baseline is where we feel completely at ease and at peace with the world. And many of us don't get to that place anymore. So I want to talk to you a little bit about stress, some of the causes of stress, and what we can do about it. I think when we remind ourselves of the implications that stress has on our health and our wellness and our state of being, then we are motivated to make changes. So I hope this is a very good reminder for you. So let's get started. Stress. One thing I want to point out is that there are differences in stress. We are all familiar with this term distress. These are obvious cases of stress. We've lost our job, financial issues, the death or the illness of a loved one. These things are noticeably stressful for us, and we expect to feel negative implications or negative consequences from this type of stress. The other type of stress is eustress, and eustress are positive stressors in life that can equally have consequences in our health and well-being. Eustress could be marriage, a job promotion, the birth of a baby. These things that are positive life events, however, they can be equally as stressful. And there's something called a stress checklist. Psychologists use this stress checklist quite often, and if you look through it, I think it's very interesting because it's a questionnaire and it tells all the different stresses, how many you've had over the past few years to assess your current level of stress. And it's interesting to note how many of the stressors that are listed are distress and how many are eustress. So when somebody comes into my office, oftentimes they may not feel like they have a stressful life per se because things are going very well. But sometimes those things that are going well can still mean big changes and have consequences in our state of health. The other component of stress that we don't always think about are the environmental stressors. And these I like to focus on a lot during my 21-day cleanse program because I think it's one of the reasons people don't feel well. My labs often come up normal. The doctors don't really have much to say, but we're walking around feeling tired and we can't think straight, and this lower level of health, a lower quality of life, we don't sleep well. And part of it has to do with the environmental stress. And the environmental stress that we're thinking about are the modern day stresses of computer screens, cell phones, television, traffic, the amount of media that we are exposed to these days. We hear about information all around the world, and often that information is not positive. So it creates this sort of environmental stress that we are all dealing with on a daily basis. And I want you to take this time to recognize how many stressors are new to us in our modern life. It's been very recent in our history as human beings that we have this type of constant stress in our lives. So think about it, take a walk through your day. Morning, we often wake up to an alarm clock that jolts us out of bed. We often have coffee in the morning. Maybe we skip breakfast. Maybe we have something quick and sweet for breakfast, which is not ideal. We're getting the kids ready. We're listening to the news, what happened through the night, and again, often it's not positive. We're sitting in traffic. We're racing around. We're trying to get to work. We've got demands on us. So things that were just different than what we were used to thousands of years ago, even just 100 years ago. Things have changed for us dramatically. So put that into the equation. The other component with stress that we don't always think about are the genetic factors associated with stress. And there are some key genetic components. We won't get into them in detail today, but I just want to put it out there that there are certain conditions, pyroluria is one of them, and something called MTHFR. These are genetic variances in the way that we metabolize nutrients, put it simply, and both are fairly complex. However, my point being that when you see stress-related issues that run in families, often you can trace it back to genetic factors, and when you can pinpoint these genetic issues in families, they're easier to correct than you may think. And with some simple changes, you can correct the way somebody handles stress. And one example would be a condition which is called pyroluria, and it's where people don't metabolize B6 and zinc very well, and so they cannot create healthy brain chemicals the way that other people are able to. So you identify this condition in some people and you change the way they're able to metabolize B6 and zinc and some other nutrients, and then they're able to handle stress in a way they've never been able to handle before. So there are clearly some genetic issues that can be corrected that help to determine how somebody will handle their stress in their life. So this is very fascinating to me, that stress is an underlying factor in up to 90% of doctors' visits in the United States. 90%. This is a huge number. And what this tells me, and what I often see in my practice, is no matter what's going on in somebody's life, if you address the underlying stress component and support somebody and their ability to handle stress in their life, whether it's just stress or eustress, you see a lot of symptoms go away. And symptoms that you may not think of would be related to stress. We often think of stress with anxiety and depression, insomnia, but there are a lot of physical manifestations of stress that become apparent when you deal with the stress, and then the symptom goes away: muscle pain, joint pain. You start to see labs change. So it's a very interesting component here, and it shows us, especially in the United States, how much stress is impacting our quality of life and our health. Okay. So here's some symptoms of stress. We could go through the list here: headache, high blood pressure, fatigue, irritable bowel, anger, muscle ache, shortness of breath, mood swings, alcohol abuse, forgetfulness. The point here is the list goes on and on. Everybody is going to express different levels or different symptoms associated with stress based on their unique biochemistry. For some, when they have a lot of stress, they're going to be prone to headaches. For somebody else, it's going to be depression. For somebody else, they're going to hold it physically in their body in joint and muscle pain. So it's really going to be very independent. But just know, across the board, really any sort of symptom can be associated with your ability to handle stress. Okay, so this is a great topic here. This is one of my favorite topics to cover, and it's the adrenal glands. If you're not familiar with adrenal gland physiology, the adrenal glands are small glands that sit up on top of the kidneys, and they are responsible for secreting different hormones related to stress. We also call these our fight or flight glands. And the adrenal glands are so important. I want you to think about your adrenal glands as your life-saving glands. Because they are responsible for fight or flight, everything that the adrenal glands produce are key to our survival. So we all have highly adapted adrenal glands. So let's put it in perspective. Most of our time on the planet as human beings, we have been more hunter-gatherers, foraging out in the woods before modern civilization came around. And we had relatively stable lives in terms of foraging, finding food, and throughout our day preparing for different seasons. And it was stressful, but it was stressful in a different way. Our adrenal glands are highly attuned so that we can run from what we call a bear or fight a bear. So here's our scenario. We are in the woods, we're hunting and gathering, we're foraging for our evening meal, and we sense danger. All of a sudden there is a bear in the woods, and our adrenal glands kick into action and produce hormones that allow us to fight that bear or run really fast from that bear and get away. So it's life-saving here. And then the key here is, once we have moved past the danger and gotten out of harm's way, we no longer are producing the same amount of fight or flight hormones. We are now at what I call baseline. We are back to being in the moment, looking for our berries, our nuts, and our seeds, finding shelter, whatever it is that we are doing in pre-modern civilization. And we are doing it at relative ease and grace and a lower level of stress. Now, let's put ourselves in modern civilization, and we no longer are looking at having a bear in front of us. But what we have most days, which is different from our pre-modern civilization, is I think we have small bears all the time. So our adrenal glands are constantly being stimulated every time we look at our bank account, or we sit in traffic, or something happens within our day. You know, we get an email from a colleague that upsets us, a Facebook post, all these things in modern society that we're not used to. So if we were to map out our adrenal glands on a minute by minute basis, we're secreting adrenal hormones that were really only meant for those big dangerous situations, pre-modern society, fight or flight. And now we are slightly fighting or flighting throughout our day. And what happens is the adrenal glands start to get tired, essentially. They say, no more, I don't want to do this anymore, I only have so much reserve left. And so you end up with all kinds of different problems. Blood sugar problems are a big one, and you'll hear people complain of this often, where they have trouble skipping meals. It's interesting because when I'm doing one-on-one consultations with people, my people that don't do well skipping meals, when I ask them, how do you do skipping meals? They'll often say, what? Skip a meal? Why would I do that? They don't even go there because they know the consequences of skipping meals. They're going to feel lightheaded, irritable, and shaky, and grumpy, and often their spouse knows this very well, and you'll see sometimes that spouses will keep snacks for their significant other because they know, they can sense when a low blood sugar issue is coming on. Those chronic times of having low blood sugar often as well can lead to diabetes, which we see so rampant in our population. The other thing, that a constant demand on the adrenal glands, constantly producing cortisol, which is your stress hormone, will directly stop your production of your thyroid hormone. And many women in particular are very keen on their thyroid hormone, because thyroid hormone, when it's not being produced optimally, it will cause things like weight gain and puffiness and depression. People are pretty well versed on thyroid hormones and some of their symptoms. Often, though, it's about removing the stress and getting the adrenal glands to function well so that the thyroid can produce the hormones it's supposed to produce. So you get nervousness, sugar cravings, body temperature is off. People feel swollen sometimes. Even their fingers and midsection will be swollen. A lot of this comes back to our adrenal glands and our ability to handle stress. I'll tell my menopausal women, if I could have gotten you in a couple years before that and really support the adrenal glands, they are responsible for making hormones after the ovaries stop producing the hormones. And so you can really bypass a lot of menopausal symptoms by focusing on adrenal gland health. And I think you're going to see this being more and more of an epidemic when we start to get to the root cause of so many thyroid issues, so many blood sugar issues, obesity issues in this country. We're going to look back at the adrenal glands and see what a key player they are in all this different pathophysiology in the body. Test, don't guess. When we have reliable testing methods, I really like to use them when they give us the kind of information that we need that's going to be applicable. I also like to test one thing at a time. This is a big deal to me. I oftentimes see people come in with 5, 10 different tests from their physicians or tons of different supplements, and it can get overwhelming. You have to really decide what you're going to start with, what you're going to work on before you move on to the next test. And the adrenal test is something that I feel can be really key starting place for a lot of different people, especially when a lot of their screening labs are normal and they just really don't feel well. So I just want to show you briefly, this is somebody's adrenal stress profile. I've got my cursor out here. You can see the dotted lines. Cortisol has a nice pattern, and it wakes you up in the morning, makes you feel great, and it starts to lower in the afternoon. By the evening, it's nice and low when we go to sleep, and then we're able to rejuvenate through the night, and then we wake up feeling great again. So we should fall somewhere in this dotted line. This patient in particular is up here way above the dotted line. They are in a super high cortisol, high stress state. They are seeing a bear in the woods at every point of every day. And this is not a great place to be. Now that we see this pattern, though, we know exactly how to correct it and what to do about it so that we can get this person back into a more normal cortisol pattern. And what's great about this person's pattern is we are catching it preventatively because it's so high. Sometimes people get to a point where they're not even able to produce the kind of cortisol they need to produce to feel really good and healthy. And you'll see sometimes people flatline and they're way below the curve here. And then that is often associated with significant fatigue and fibromyalgia type issues. And that's a tougher place to be when the body is so depleted it can't even really produce cortisol, a life-saving hormone that it needs to produce. Okay. So here's baseline. You can take a look at this woman and see how we're really supposed to feel the majority of the time. I'm a big believer in finding our baseline again, where we are free from that bear in the woods. We are foraging, we are gathering, we are in the moment, just like pre-modern human beings would have been. And many of us can't even begin to feel or to know what baseline feels like. And it's a process to get back to baseline. It's a process to stay there. I believe that this is one of the more difficult components for us in our modern society. I think by focusing on things like nutrition, getting your nutrition in line, your exercise in line, and as we discussed before, there's some key nutrients that help you produce healthy brain chemicals, supporting the adrenal glands. All of these things in combination will allow you to be able to come back to baseline a little bit more readily. So if it's a big struggle, like it can be for myself, to incorporate those moments in the day to get back to baseline and to really feel centered, when you're really making those attempts to get back to baseline, you can do it with more ease, and it will feel more natural to you when you have worked on all the other components of health. For some of us, getting back to baseline can be torture. For some of us, everybody knows by now how good meditation can be, or trying to quiet the mind. But for those of us who are not balanced in all the other areas of our life, when we try to meditate, we start to feel like crazy people because our mind goes so quickly, and we are so type A and driven that it can almost be a detriment to us. So finding other ways to support yourself, as well as incorporating techniques to get us back to baseline, doing all of that will provide you with more ease to be able to find that balance again. Okay? So we have to find ways to improve stress. Diet, food is medicine, lifestyle, baseline, adrenal health is really the key to maintaining balance and focusing on those toxic 10. When you focus on the toxic 10 that we've been going through, all of these things fall into line quite nicely. We have something on the program that we do every day during the 21 days that is about getting to baseline. It's helping you take a small portion of your day out, just a few minutes of every day, to find baseline again. It's much easier when you're doing a program because you're doing the dietary component, the lifestyle component, you're focusing on all of the toxic 10. So this baseline piece fits in very nicely, and people feel really good and centered by the end of the 21 days. So it's very helpful. So here we're going to end on a lighter note, top 10 stress management techniques. Eat, sleep, eat, sleep, eat, sleep, eat, sleep, said by a cat. And this is one of those cats that's very comfy in the corner and that sleeps all the time, not your neurotic kitty cat. So I agree with this, and I think as our modern society of go-getters that most of us tend to be, we really need to take a lesson from our kitty cat here and do more of this eat, sleep, eat, sleep. So I hope you found this information helpful. Again, I'm very passionate about finding balance through stress relieving techniques. Make sure that you please visit us on Pinterest, Facebook, our blog. We update these regularly, and our goal is to give you really good, valuable content and give you some insight into your own health and wellness. We're simplifying the process of nutrition, and we're doing it through these 3 main social media networks. So please join us there, and I hope you have a healthy day.